Let's go to the story that's been making headlines. There's been mixed reaction to images of newborn babies in brown cardboard boxes at a hospital in the Northwest. Now, the incident surfaced when a Facebook post went viral showing the babies wrapped in purple hospital blankets with nasogastric tubes. According to the department, the manager allegedly failed to report the section that had to place newborn babies in the boxes due to lack of resources at the hospital. Let's speak now to the chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, who joins us live now. Doctor, thank you so much for your time. Firstly, what is SAMA's reaction to this incident?
Good afternoon to you and to your viewers, and thanks for having me in your program. SAMA is very disappointed, but really what has happened is not unexpected. Because you will recall that incidents like these have been very common recently, as also highlighted by the report of the Ombuds in Gauteng. And the Ombuds have said that, this picture can be seen across the country with, obviously, exception of some provinces like the Western Cape. But obviously, what we see now is what is on the ground. Workers are struggling on the ground, and they're using whatever they can use to assist the situation.
Is it a lack of resources and also to be blamed on the part of those who are running the hospital? Is it apportionment of blame supposed to go to the provincial department, the national department, or is it simply because those who are operating in these hospitals do not care?
There are a number of factors there, Bongi, that can be said at this point in time. You'll recall that the health budget, has been decreasing over so many years by 1%. But on top of that, we've got a crisis of leadership, as highlighted by the Ombuds report. The other thing that we've noted also was the incompetence of the CEOs who are running the hospitals, the lack of leadership and governance in the hospitals, because you can't tell me that just one incident, there is no cribs for babies, and that is blamed on the nurses and the clinicians on the ground. It tells me, that there is no foresight, there is no planning that is in place. That includes everyone who's involved in the running of the day-to-day issues in the hospital.
There's talk, of course, and some reports, I'm sure you've seen them, suggesting that the nursing manager at the hospital failed to report this to the acting CEO, that they had to place the babies in cardboard boxes because of the shortage. If this is the truth, then it's also serious. I mean, it means that there's now incompetence again on the nursing manager's part, if it is the truth.
I like what you have just said now, saying if, because Dinosa is coming up with a different story. To say that the report has always been there, the CEO was always aware that there are shortages, on the ground. There are challenges in terms of the equipment. But what we do know is that according to the World Health Organization, we are only sitting at 30% of the workforce that is expected, to be in our healthcare system. So you can expect that, challenges of this nature would surface, time and again. So we cannot really use healthcare workers as scapegoats when actually a poor performance is at a higher level, as we know it.
But 30% is a disaster waiting to happen.
It is a disaster. All we do, Bongi, in this country is to identify the problem, make a diagnosis. We know what the problem is, that there's a shortage of healthcare workers. We even go to parliament. A minister tells parliament that we've got a shortage of healthcare workers and states the number. But all they do is to write a policy called 2030 Human Resource for Health Strategy, and they put it there to gather dust. There is no implementation at all. All they do, they are very competent in writing policies, but not with implementation.
Now, when you look at, these particular boxes that the children were put in, there are several risks that, one can even identify. Of course, they were in blankets, but there are concerns, just that alone. But let's talk about the boxes themselves. The boxes, I didn't see any marks on them. I don't know if they told you, maybe from your vantage points, there were marks on them. How do they know whose baby is it? Which baby belongs to which mother? Because I didn't see any labels at all.
What usually happens is that there are labels that are put on the arms, around the arm of the child, that would identify which child is which. So I don't think there should be a crisis around that. But, regarding the boxes, the use of boxes, it's something that should not have happened. But when healthcare workers don't have anything to do or to use at that point in time, they make means of trying to save the day. And at times, use things that are not supposed to be used. I can tell you, I've worked in government. I know sometimes when you inform these CEOs that there's a shortage, they get irritated. In fact, they do fight with you at some point. And you find clinicians stopping doing their clinical work and doing management work, at times looking for bed availability in other institutions when the CEO is sleeping.
So which means now we should be looking to the CEO and asking some very difficult questions, if I'm listening to what you've been saying throughout this conversation.
Yes, I don't think we should allow the CEO to run scot-free, when he is the accounting officer. When everything goes wrong there, they should be digging deeper to say, where is the plan? We see what has happened now, what's up is now, but where is the plan of everything? If they like, they need to do the Ramaphosa strategy of investigating. In most cases, that's what happens. Just investigate and find out what's the problem. But you need to be broader in your investigation. You can't just target that particular day, because it must give you projections. What was the expectation of the institution, regarding their workload and also the population that they are serving?
Especially when you think about the fact that there were more than 55 babies, some reports are suggesting, in about 25 incubators, looked after by 7 nurses. If this is true, that is another thing that, of course, is a cause for concern. But let's see, as you say, what happens then with this particular investigation, because the MEC says they're investigating. So we're going to wait then to see where the fingers are pointing conclusively as to what happened here. But let me thank you for your time, Dr. Mzukwa. Do appreciate it. That was the chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa.